So I will, if you will be like studying with me the general pathology, I will be telling you that how hydrogen peroxidase is important in your detoxification. Okay, this is a free radical. Hydrogen peroxide is a free radical, and it is it detoxifies. Okay, so this glutathione, even we have a disease, even we have a disease. Okay, you will study that Chedick Higashi syndrome and all. Okay, in pathology, in pathology with me. So for now you have to remember this process. Or if I can like if I can like tell you a bit about those right now, it will clear your concept better um, regarding this whole process. So let me kind of tell you a bit about this. Okay, so I will shift my screen to, I will pause the screen, and then I will shift my screen to this whiteboard. We are having a heavy rainfall and a storm kind of a thing. But okay, so you see this is oxygen. Okay, and then this oxygen is converting into O negative. Okay, you called it a superoxide. Okay, this oxygen is converted into a superoxide, and then the superoxide is converted to H2O2. Okay, this superoxide is converted into this hydrogen peroxide, and then this hydrogen peroxide gets converted to HOCl, that is what we call hypochloric acid. So this is the mechanism. Now what happens is, here we uses an enzyme which is called Na. This is basically some part of pathology, general pathology, that I'm teaching you just to clear your concept that how a glutathione is important. Okay, NADPH oxidase. Okay, I will not write the complete name. So this is NADPH oxidase that is helping convert this oxygen to superoxide, and then the superoxide is converting into hydrogen peroxide by an enzyme called superoxide dimutase. Okay, superoxide dimutase. Superoxide dimutase. Okay, and then this hydrogen peroxide is converting to HOCl by an enzyme called myeloperoxidase. So myeloperoxidase. Now you see this HOCl, this HOCl kills bacteria. This HOCl kills bacteria. So the key enzyme to kill bacteria will be, definitely the key enzyme to kill bacteria would be this myeloperoxidase. So you see now, at this particular level, when you have been converted to H2O2, this whole process that's going on is not that easy and simple. You are also having this you will, wait a second, resume share. Okay, you will be having this dimutase also that will be helping you to convert this H2O2. Okay, the dimutase, the glutathione peroxidase enzyme is helping you convert this water into H2O2 here at this particular level, glutathione peroxidase enzyme, and the NADPH2 NADPH2, which has this NADP, is converting into this NADP. Okay, which comes, this comes from the electron transport chain. This is being converted via this glutathione peroxidase. But on the other hand, we have this glucose 6 phosphate, which is coming from the glycolysis cycle, okay, is being converted, is converting, uh, is using this, okay, and converting it into this and then into another product. And the enzyme we are using is glutathione mutase. So you see, this whole mechanism which is going on is really important to kill bacteria. So I will clear this all, and you will be studying some diseases like Chirek-Higashi syndrome and chronic granulomatous diseases and others, okay? So you will be studying these all diseases in the chapter inflammation um, from general pathology, which we will be starting soon. So um, kind of let's go back to our book, okay? Let's go back to our book and try to complete vitamin B6 in this lecture. So now you're kind of well aware of what I'm trying to teach you right now is um, how this glutathione is helping you in forming H2O2, and then this will be converted to HOCl to kill bacteria. We call this all process as oxidative burst, okay? Oxidative burst, we call it. So if you can like give a quick review what it is written here, you will also understand that NADPH is necessary to keep glutathione in its reduced form, which in turn detoxifies free radicals and peroxides. So decreased NADPH in RBCs leads to hemolytic anemia. So when there will be decreased NADPH in RBCs, it will lead to hemolytic anemia, that is, RBCs will break down due to poor RBC defense against oxidizing agents. Okay, and like they includes lots of drugs, fava beans, and lots of drugs like sulfonamides, nitrofurantoin, primaquine for malaria, chloroquine for malaria, and anti-TB drugs also. So these are oxidizing agents that that are destroying this NADPH into all that. And when we will not have this, it will not let it be in reduced form, and the RBCs will undergo hemolytic anemia. And I told you that defense mechanism also. So the patient will have infection, okay, and that can also precipitate hemolysis, like breakdown of RBCs. Inflammatory responses that will be going on will produce free radicals, as I told you, HOCl, okay, that diffuse into RBCs and causing oxidative damage, and we call this oxidative burst. So you have to kind of this now see this how this biochemistry is basically linked with your journal pathology, and then with your hematologic pathology also, because now you are seeing white cells, you're seeing Heinz bodies. If you kind of go and recheck your notes or something for your hematologic pathology, so we study these things over there. So so let's go back, because this was not our topic. Our topic was vitamin B6. So now you kind of get the concept that it is important in the synthesis of glutathione, and then cystathionine in a similar way, okay, is used in certain reactions, and then heme. Okay, so one thing I just told you, the production of heme also requires this B6, okay, and then niacin, and then histamine, and then these neurotransmitters including serotonin, epinephrine, norepinephrine, and then dopamine and GABA. So you have to remember all these things, and I will take you to the book Lippincott. Okay, so you can read this pantothenic acid from in here. If you don't have the textbook, I will upload this book in drive, and I will share you the link so you can check this in detail as well. So this was vitamin B5. Okay, and it's nothing is, different within here, but like as you're in doctors, you should know B5 is present in eggs, liver, and yeast. Okay, and now I'll take you to B6. Where is B6? This is D, and this is A, I guess. And then we have pantothenic acid, biotin, B2, niacin, B1, B6, pyridoxine. Now see, let's give a quick read to vitamin B6, pyridoxine. Okay, so vitamin B6 is collective term for pyridoxine, pyridoxal, and pyridoxamine. Okay, and all are derivatives of pyridine. Okay, they differ only in the nature of functional group attached to the ring. Okay, so forget about this thing, because you're not like an old school student now, so you have to just need to know the clinical importances. Pyridoxine occurs primarily in plants, so the source of vitamin B6 is plants mostly, whereas pyridoxal and pyridoxamine are found in foods obtained from animals, so you can get it from both. Okay, so no worries if someone is only a vegetarian or a meat eater. All three compounds can serve as precursors of the biologically active coenzyme pyridoxal phosphate. Okay, that I told you, PLP, it is converted to this PLP, pyridoxal phosphate, and pyridoxal phosphate functions as a coenzyme for a large number of enzymes, particularly those that catalyze reactions involving amino acids. So now you see, these are all the details that you just read. Transamination, oxaloacetate from your TCA cycle is converted to glutamate. Okay, they both, glutamate and oxaloacetate, combines and forms aspartate, and then alpha ketoglutarate. Okay, also a product of your TCA cycle. So basically transamination is going in your TCA cycle, and you form that AST and ALT from here, which are liver enzymes. And then deamination, okay, the serine is converting into pyruvate and then amine. Okay, just forget this. Then decarboxylation, histidine is an amino acid which is only found in children. Mark my words, histidine is only found in children, not in adults. Okay, and it is converting to histamine plus carbon dioxide. Okay, and obviously involved in the protein metabolism. Then condensation reactions, in which glycine, an amino acid, is converting to succinyl-CoA of TCA cycle, and it is making alpha aminolevulinic acid, which is responsible in the production of heme. Okay, so now I am telling you, because I have studied this Lippincott really well. So if you do not have this heme synthesis cycle in your mind right now, I am kind of telling you, you have to trust me and you can go and check it. Okay, so alpha aminolevulinic acid is the rate limiting step for this heme synthesis. Okay, so it was previously written in your first aid that it is involved in heme. So now you get it how. So next is, it's very little, so I'm kind of reading it completely. Let's see the clinical indications for pyridoxine, what it is. That now this is very important. It is also present in your first aid. Isoniazid. Isoniazid is an anti-tubercular drug. Okay, it is an anti-tubercular drug, a drug frequently used to treat tuberculosis. Can induce a vitamin B6 deficiency by forming an inactive derivative with pyridoxal phosphate. Okay, so if there is a patient who has TB and you are prescribing that patient isoniazid, you have to give that patient vitamin B6 also, okay, because vitamin B6, this drug can cause vitamin B6 deficiency, okay. So dietary supplementation with vitamin B6 is thus an adjunct to isoniazid treatment. You getting my point? Otherwise, dietary deficiencies in pyridoxine are rare, but have been observed in newborn infants. Okay, newborn infants fed formulas low in B6. So the newborn infants that do not are not feeded on breast milk of mother, and they use those formula milks. So, and if they lack this B6, they can also have this deficiency of vitamin B6. Okay, and also in women who take oral contraceptive medicines and are alcoholics. So because alcohol, because alcohol mechanism, we just studied ethanol metabolism, okay, how it hinder. So you can kind of remember these things because they are present in your textbook Lippincott and also in your first aid. Now see, the patient has convulsions, hyperirritability, peripheral neuropathy. When there is a toxic situation, then you will see this. Okay, not in every patient. Deficiency inducible by isoniazid. Okay, now isoniazid, anti-TB drug, and oral contraceptives. So mothers taking oral contraceptives, OC pills, and TB patients taking isoniazid can have this vitamin B6 deficiency. Okay, so prescribe them along with them. And sideroblastic anemia. So sideroblastic anemia, in which you see this sideroblasts, okay, in your spleen, so in your blood, and it affects your spleen as well, because RBCs are being broken down, and you and you have that hyper splenomegaly. So mm, you have to kind of remember this also, sideroblastic, because when you will be studying other vitamins and you will be completing this vitamins course, you will be reading microcytic anemia, macrocytic anemia, sideroblastic anemia, iron deficiency anemia. So you will be having these four terminologies of anemias, and they ask that in which anemia is responsible vitamin, what it is. Okay, so the responsible vitamin for sideroblastic anemia is vitamin B6 due to impaired hemoglobin synthesis and iron excess. And I just told you alpha aminolevulinic acid responsible for it. Okay, let's finish this last topic also, and then we will discontinue our class. So what happens when you have this toxicity of pyridoxine? It is the only water soluble vitamin with significant toxicity. Okay, water soluble vitamin with significant toxicity. Neurologic symptoms